If you've ever brought up a concern about your child and heard the words, "let's just wait and see," you probably had two reactions at the same time. Relief, because maybe it's nothing serious, and confusion, because you still notice something and now you're not sure what to do with that. And here's the truth most parents aren't told clearly. Wait and see is not a dismissal, but it also isn't a plan by itself. Today, we're going to break down what it actually means when a pediatrician says that, when it's appropriate, and when waiting should actually turn into closer observation. Parents tell me versions of this all the time. My doctor said to wait, so I guess everything's fine. Or the opposite. I feel like something is different, but everyone keeps telling me not to worry. That uncertainty can be incredibly difficult. As a parent, you're with your child every day. You're often the first person to notice when something doesn't feel quite right, even if you can't yet put your finger on exactly what it is. Maybe it's speech, maybe it's attention, maybe it's interaction, or how they respond to their name. Then you go to an office visit. It lasts 10 or 15 minutes and you're told, let's monitor this. You leave wondering, am I overthinking this or did I notice something early? The reality is that wait and see has an important place in pediatrics, but only when it's an active plan, not a passive one. Parents should understand what developmental skills they're watching for, when they should expect to see progress, and when it's time to take the next step. That clarity can make a big difference. When a pediatrician says wait and see, it means we don't have enough evidence yet to label this as a concern, but we do want to watch how it develops. In other words, it's a monitoring strategy, not a conclusion. What matters is whether skills are emerging over time, not whether everything looks perfect in the moment. One of the biggest misunderstandings parents have is expecting development to be obvious in a single moment. But development doesn't work like that. It shows up as small changes or gradual shifts, uneven progress sometimes. A child might say more words at home than at school, engage one day and not the next, show skills inconsistently while they're building them, and that inconsistency can be normal. So waiting only makes sense if you're also watching for change. Development is a pattern, not a moment. There are two very different versions of wait and see. Passive waiting sounds like, let's just ignore it for now. Active watching sounds like, let's keep track of what we're seeing. Active watching includes noticing what is improving, what is staying the same, what shows up across environments. One is uncertainty, the other is information gathering. Watchful waiting only works when the watching is active. Parents often dismiss their own concerns because they don't have clinical language for it. But what you notice daily matters. You see how your child responds to their name, how they play, how they interact, how they adapt to changes. That doesn't mean you're diagnosing anything. It means your observation is part of the picture. Clinicians rely on parent input for a reason, but it becomes more useful when it's specific. Your concern is not a diagnosis, but it is very useful data. If something feels off or unclear, the most helpful thing you can do is shift from general worry to specific observation. Try noticing, what exactly are they doing? When does it happen? How often does it repeat? Does it show up in different settings? This turns anxiety into clarity, and clarity is what helps clinicians make better decisions. Specific observation turns worry into information that your pediatrician can use. Waiting and observing has limits. It should shift into further evaluation when there are consistent patterns over time, such as skills not progressing as expected, concerns appearing across multiple environments, loss of previously acquired skills, persistent difficulty with core developmental interactions. The key idea is not a single behavior, it's whether development is moving forward. Waiting has an endpoint. It can either be progress or a potential conversation with your pediatrician. Here are some takeaways. If a doctor says wait and see, ask, what specifically should I be watching for? Write down or note examples when something stands out. It makes follow-up conversations way more productive. If your concern grows or becomes more consistent over time, it's a really good idea to bring it back up to your pediatrician. If this helps clarify what wait and see actually means, make sure to subscribe to our channel. You're not alone. This is one of the most confusing parts of early parenting. We break down child development in a way that helps parents understand what they're seeing in real life, not just theory. And if there's something that you've been worried about your child's development, leave it in the comments. It may become a future episode of the things no one tells parents.